Hey Nick, so listened to your presentation. Very nice, very well put together. Um, I'm definitely going to be picking some of the, definitely with PubMed. I've never used PubMed, and so I'll definitely have to give that a shot. Um, Looked like it was pretty easy to navigate through and decipher, what you wanted to use um, for your studies. And nurse-patient ratio is always a topic, right? We're always talking about that and trying to be safe. I know on my unit, we are very strict on our. We kind of have two units in one, so we'll do on our med surge side is always 4-to-1. We don't do anything more than that. It's always 4-to-1. And then on our intermediate care side, we'll do 3-to-1. And the reason for that is we want to provide quality care to patients, not just have bodies in the rooms. We want to provide the good quality care, and we feel like it's not really it's patient safety as well. Not only are you providing them quality care, you're able to give them more of your time and check on them more frequently. Better quality nurse rounding. You're able to my topic for this week has to do with bedside shift report, and so I think that also helps with patient safety and ties in with ratios as well, because the less patients that you have, the more apt we are to actually go in the rooms and do a thorough bedside shift report the way it's supposed to be, to save time and all of that. Most of the nurses that I've encountered, that's their biggest complaint, is that bedside shift report takes too much time. And if they've got 5 and 6 patients, I could see that taking a little too much time. So I think you're onto something with the patient ratio thing. I did find an article that this one happened to deal with nurse to patient ratio with medication errors, which is obviously a huge safety issue. Maybe you might find something in it that might help you. But it's really cool. It starts with a PICO question, and goes through all. It's got some graphs and some analysis. It talks about nurse-patient ratios being 1-to-2 versus 1-to-3, results and findings with that. And this is done by a lady named Carly Sutterfield and her colleagues Jasmine Riley and Jacob Holt. And they're out of Washita Baptist University. Kind of a weird name, but you'll check it out. I'll post the link to the article here. But they used it shows what methodologies they used and things of that sort. So you might find it helpful, maybe not. But anyway, it was great checking out your stuff. I definitely will be picking some of it up whenever I go to do my stuff for the rest of the week, as this class has been pretty challenging, so I can use all the help I can get. Thanks, Nick. See you next time, buddy.